The first one is anorexia nervosa, often simply called anorexia, is an eating disorder characterized with abnormally low body weight, intense fear of gaining weight, and distorted weight perception. The maximum peak of incidence occurs in adolescence. It is estimated that it affects 1% of women under 25 years of age. People with anorexia nervosa have a misperception of their own body image. No matter what their weight or percentage of fat is, they tend to look overweight. Symptoms are usually divided into two types: behavioral and emotional. Behavioral symptoms: restricting food intake, exercise, lying about eating behaviors, complain about their personal appearance, social isolation. Emotional symptoms: exercise concern about food, fear of gaining weight, depression.